my topic for today is research in India, and I'm going to give an overview of how research has changed for good and for bad, both ways in last 10 to 15 years. So before we begin about talking about good and bad research, I like to you to have the concept of what is research. If you ask yourself what is research, everybody will have a different answer to it. Lot of you will have research as just papers or something published in a journal or something to be done as an experiment or something. I define research as pursuit of knowledge for betterment of patients. That is the wholesome definition of research. That is the end point and the starting point of any kind of project, any kind of paper, or any kind of thing that is associated with research in orthopedics. We are all conceptual people. So we, in last 1.5 days, what we have learned is concept about various things in office orthopedics here in this conference. So we have learned and heard about concept from various speakers, and we try to integrate those concepts within ourselves. So we try to integrate those concepts, make them meet to the conceptions that we have already, and create a paradigm in our minds. That is how we work. That is how we create a view for academics, for orthopedics, or for our practice in all sense. But this is a dynamic paradigm. We acquire new information. So in this conference in NMOACON, you must have acquired a lot of new information. It fits into the old information that you already have. And that is what I describe as research. It's a dynamic paradigm. It's a way of life when we look at research. So research is not just papers or writing or doing experiments. It's a way of life that we do. It is already defined as present, future, and past, and so are the studies. So we have retrospective study, prospective studies, and cross-sectional studies. So research is pursuit of knowledge in all sense. We as surgeons, we share our experience. So we share these pursuits that we do. You have heard about scientific deliberation, free papers. Those are all pursuit of knowledge that various surgeons have pursued and are sharing with us. Publications are just one of the way. Okay, it is just one of the way of sharing this experience. It is not the only way, and it is not the major way. Conferences, discussion among colleagues, all this is part of research. And you have to never forget that the end point of research is betterment of patients. If you achieve that, that is the success of research. Otherwise, it is not. Orthopedic research in India. We have a lot of differences from Western world. In India, research, education, even talking about knowledge is in a very different sense. So we are teacher-centric people. So we go by word of mouth from our teachers. And we are very patient-centric. So we have focused on individual patients based on the teaching that we get from our seniors and treat. Most of the time that is the paradigm that we have in India. While the Western world is very divided. It is literature centric. What is published in journals and academics or textbooks, as well as population centric. So this is a difference in philosophy from Western world and the Indian continent. So this is why we are different from them. Now we are trying to accept their paradigm. We are trying to accept population based, publication based academics. It doesn't mean that one is wrong and other is correct. So the truth lies somewhere in between. You have to balance both. We cannot go just by literature and we cannot go just by experience. So we have to combine both. So the Western world is also at fallacy when they don't look at experience and they don't focus on patients. So that's what the thing is currently. And in last 15-20 years, this paradigm is changing. So there is a lot of to and fro motion between literature, experience, evidence-based medicine, and that's all happening due to a lot of introspection that we have. So especially in India, a lot of surgeons are now introspecting in terms of research. And like I said, maybe 20 years back, very few, maybe 0.1% of surgeons were thinking about research, but now there is a sizable number who think about it and conceptualize about it and introspect. They face a lot of issues. So these are some misconceptions that I have found out among surgeons and how they tackle it. I'll just take you through some of them and how they have changed over a period of time. A lot of people used to think that research is not my cup of tea. But like I said, research is pursuit of knowledge. And you all do research when you read your books, when you read your journals, when you operate, when you treat your patients, when you rehabilitate them. All is part of research. And it is what is called as experience. Your life experience is a part of research hierarchy and it is called level 5 evidence. So that is very, very strong foundation for all research. I'd like to give example of Dr. Padar. This is a small town, Padar Hospital in between MP and UP. It's a tribal area where Dr. Nihar Padi was working between 2002 and 2006. He used to collect data of all these tribals. He used to fall from trees and from height. They used to jump and get these open injuries. And he used to treat them with external fixators. And he collected this data over a period of 4 years and published this in Injury. And this is one of the highest cited articles in this particular injury. So it was a very, very simple thing that he did in a very small remote place where didn't have large infrastructure or many resources. But he could come up with this idea and bring it forward to the world so that other places where such insufficiency exists can use this particular model. So this is very, very important thing that he thought about. If you feel that you see routine patients in your OPD and you cannot do any specific research, that's a misconception. What is a publishable case? Which case can be published? According to me, every case you see in your OPD, operate, admit is a publishable case as a part of case series, as a part of case report, or as a part of any other trial. So if you're not publishing or not capturing data of any patient, that is what you're missing it. It's all publishable. You have to just read journals and follow what's going on. How to read journals? The best part is just read the table of content of every journal in your specialty. I'm sure a lot of people are not even doing that. So if you're a spine surgeon, take top 5 journals in spine and just read the table of content. You'll get a good overview of what's happening and what you can do additionally in that area. Current journal topics, these are very, very common topics. Scaphoid, back pain, these are all current journal topics that are published. Very common topics. Nobody is looking for cutting edge research here. We have huge data knowledge gaps in common topics. If you don't have data, what is the essential data that you need? Patient name, diagnosis, phone number, and x-rays. That's all you need for most of the research in orthopedics. Orthopedics are very, very, the radiographs are a good resource for any kind of research projects and you can easily save them. So that is what is an essential data. Papers are already published on everything. That's not true. Literature has to be renewed every 5 years. And there are a lot of myths in orthopedics that are currently there which we can break through. For example, this particular myth of timing of fixation in femoral neck fractures. This was done in Maulana Azad College and they collected just radiographs for 4 years of 92 patients. Less than 48 hours fixation and more than 48 hours fixation. And they found that there was no difference in AVN rate. So a femoral neck fracture is not an emergency surgery. You don't have to operate at night. You can schedule it in the morning. This was when we were in the first decade of this century. We have to operate in urgently at night. So this paper busted that thing, published in JVGS 2004, and a lot of publication followed that internationally. And it became a norm that it is not an emergency. So it's a small kind of observation in a very small group of patients, just radiographs collected. You don't have time. I mean, a lot of people don't prioritize research. So it is just a matter of priority and just a matter of giving enough time to it. You need to prioritize and plan. That is how it works. Nobody can give you time for anything. If you are dedicated to something, you will find time for it. But how much time is needed? Like I said, Dr. Nihar had over 4 years collected just 60 patients. Not many. Hardly 1 or 2 hours in a month is what needed. You don't need much time to publish or do research at all. Practical misconception, patient do not follow up. How much follow up is needed? Depends on diagnosis. Just need 1 year, 2 years, something like that. For most of the trauma, you just need 1 year follow up. You don't have to have 5 years or 10 years follow up at all. Patient do not follow up. You plan a study which is early outcome. Just post op 3 weeks or 6 months, something like that. So plan according to what you have and plan a simple study. Patient number is not enough. How many patients are required for a study? This is for June 2021 BJJ, which is British. Average cases per original study was just 71. You don't require huge number of patients also. For example, uh, you can know what is the basic number of cases required by reviewing last 2 years article. This is for the proximal tibia fractures, and mean number of patient is just 36. I think most of the trauma surgeon here would get 36 cases of proximal tibia in a year or in 2 years. Very easy to follow them in for just 1 year and publish a paper about what your findings are. See, your aim is always sharing your findings so that patients can be benefited. That's the aim. A paper is not the aim. Research and publication have huge personal value. I mean, once you write a paper or conduct a study and publish a paper, it is something undescribable. You will understand what it means once you have done it. Nobody can tell you that. It's like Matrix. Nobody can explain you what it is. You have to do it yourself. But it's a huge, huge personal transformation. It gives you a lot of insights into what you're doing. You will be more confident with patients, with doing your surgeries, and even talking to your colleagues about that particular thing. Especially for India, we have these kind of cases, open fractures, non-unions. These are not seen in Western world. Who is going to do research on this and publish articles? The responsibility lies always on us. So this was the entire concept which we were tackling while the transition was happening in the first decade of this century. Then something drastic happened. In 2010, there was a policy update from MMC, which required all the senior professors, associate professors to have publications. Now this worked both ways, positively as well as negatively, because once it was instituted, it was required for promotion. It was key to promotion and recognition. That is how it was put forth. Out of blue, it was just put forth on everybody of us. There was no guidance on how to go about it. There was no infrastructure to support it. There was no research department in any college. There was no kind of culture that was there in any department. No statistics. No journals are provided. In most of the college still, journals are inaccessible. Lack of research education. Nobody knew how to do a study or how to write a paper. Most of the theses were just small case series in those times. There was lack of funding, and this still exists. There is no funding at all for the research projects that we do. And there was a huge research apathy. Most of them didn't care about what was going on and what will happen. They started caring after 5-6 years when they were stopped for promotion. So this is one of the things about research. It requires high level of motivation for a long period of time. And there is huge research lethargy in our community in India. So these all factors created a lot of academic misconduct that has happened in last 12 to 15 years. Huge academic misconducts have happened from India. Data falsification, manipulation, plagiarism, ghostwriting. These were all in media too. In academic media, this was all put up, and it has created a dark name for India. So fake research papers, scientific fraud, and this was another huge black mark for Indian research. Predatory journals. We became a hub of predatory journals in last 10 years. The world's most priority journals are based in India, and this is known factor for all the academic world. The whole education sector was shaken, is still shaken. I mean, most of you must have getting emails where they ask you to submit papers and they'll publish papers. A lot of them are doing it also, just paying money and publishing it. It's a dark thing on your academic CV. You'll the thing is that about this is everything is online. Today or tomorrow it will come out and it will showcase in a bad way. Fake journals making India gone wrong. So this is still existing and still happening, and it's a huge problem for academics in India. There is literature all over the place. All these journals are publishing papers that are really, really bad. I mean, from the grammar, from starting from everything is wrong with those papers, and still they are published. Still people take screenshot and share in WhatsApp group, and everybody says very good. It's not good at all. A lot of introspection is needed from our side to understand what we are doing. We need to keep in mind that this is for betterment of patient. What we are doing by publishing bad papers is harming those patients. Okay? Still there is hope, and recent research has said that we have increased number of publications even in good journals. So this is about uh, in orthopedics only, and we have around 17.6% publication even in good journals. So it's not like only bad literature is getting published, good is also getting published. We are creating good science, but we have to be focused on what we are doing. Stop creating bad science. We need to understand that research and publication are a moral, social, and scientific responsibility, and it is a measure of your integrity. A paper with your name needs to be integral. It showcases you as a person, not just research. So shine or sham, I like to quote Peter Quill. Some things are good, some things are bad, and it's a bit of both. It hangs into balance, and we all can have a positive impact on it if we refrain from bad practices and focus on what positive we can add to literature. The road ahead is not easy, but we need to start. Thank you.